Hello friends, happy Monday. Welcome to another episode of Learn with Lo. I am Lauryn Moore, a functional nutrition practitioner, and I am super excited to be with you guys again today. Not only do I have a very fun topic, I also have a whole series planned around this topic. So we're going to get to dig deep. And the topic that I really want to dive into for you guys is infertility. I have had a nice influx of different questions, both on social media, but also in private practice, as well as lots of consults with individuals as well as couples together who are looking for some alternative opinions on this topic of infertility, especially when we start to think about the term unexplained infertility. And from a more controversial opinion, what you'll hear from me today is a good justification behind why I feel like the term unexplained fertility actually doesn't exist. The unexplained part of the fertility probably just means that that specific provider or their specific toolbox doesn't have an explanation for your infertility struggles, but it does not mean that your infertility doesn't exist. It just means that there probably is deeper questions or the wrong questions that we're not being able to ask, or the right testing that we're not really able to take a look at to be able to truly explain an infertility picture. So if you're somebody who's been told that your infertility falls under this unexplained infertility kind of category, we don't know why you're struggling, and maybe you've only really been given options of IUI, IVF, Clomid, and some of these more kind of pharmaceutical interventions to really kind of like force the infertility picture, you may not be getting the whole story, because I think we can all agree that the infertility epidemic that we're kind of seeing, it's not an IVF deficiency issue, right? It's like, oh, there's a trend here. There's a theme of why we're seeing so many increased instances of couples struggling to naturally conceive, and why the industry of IVF, IUI, and fertility treatments from a conventional medicine standpoint have rapidly exploded, which is great. Like I said, you guys, if you've been around here, you know, I'm not here to demonize or talk down to any of those types of interventions. They are great. They're awesome. We love integrative medicine. But I think where my standpoint comes into play is when we're not asking the right questions, when we're not asking the question of, well, why? Why does the body not feel safe to be pregnant right now from a female standpoint? Or what barriers or what parking brakes are actually in the way of optimal fertility? Because our body, from a biological level, was designed to reproduce. It has go back to all of our human history, like our body is really, really good at that, or none of us would be sitting here today, right? So the human body has a lot of experience, a lot of knowledge, and a lot of innate reproductive wisdom. And so a lot of times what I've seen is if there are instances in which a couple, a female, or anyone is struggling with their infertility, or even hormonal imbalances or irregular menstrual cycles, that is a reason to start to ask why. And the body's probably not broken. The body is doing that for a very real reason. We just need to start to ask the questions of why, and not give, especially women, get a lot of internalized conversations then that somehow their body is broken, and that can lead to a lot of stress, a lot of unnecessary blame and shame on the female, even though it is very much a 50-50 conversation. More often than not, the female tends to take a brunt of a lot of those conversations, and especially a lot of the mental load on that. And to me, that's just not okay, right? Because we're obviously not giving that female the right education, the right support, or the right resources to understand like why, versus really just internalizing it as something is wrong with her when there's not something wrong. The body is doing that for a reason, and the body is doing that probably for a very good reason. And if we try to just override all of those reasonings, likely there's going to be some things that pop up down the road as a result of that, okay? And it's not, like I said, a shame or a blame game. We're doing the best with all of the different science and technology that we have available to us, but I think that no one's having this conversation, and I'm willing to go there. I'm willing to have that conversation, that I don't think that unexplained infertility actually exists, because I just think that you're probably seeing a provider and a practitioner that just doesn't know how to explain it, but the explanation actually exists. Okay. So conventional medicine usually treats infertility as if your reproductive system just simply stopped working out of nowhere, right? And their answer is usually to force the issue, right? Let's push ovulation. Let's use and manipulate hormones. Let's override your body's natural processes, instead of really asking why. Why does the body not feel safe to be pregnant right now? And what are the barriers or parking brakes in the way? Not just from a female perspective, but from a male perspective as well too. And that's where, at the lowdown, at more of a holistic medicine standpoint, I'm thinking very differently. So today I really want to break down for you why, to me, more of the conventional medicine picture of infertility care really falls short, and how we can take actually more of a whole body perspective that works with it, not against it, to really start to understand why the body doesn't feel safe to be pregnant, and what are the risks associated with like forcing that issue and just pretending that down the road everything is fine, right? We know, and research shows this time and time again, whether that research is like front page news or not, it's like we're seeing that there is an increased incidence of pregnancy complications. We're seeing an increased incidence of postpartum issues in females, where we forced the issue because the body did not, for one reason or another, feel safe to feel pregnant, and we force the issue. We create the pregnancy anyway, and the body's like, okay, all of those underlying reasons of why I didn't want to be pregnant are still exist. They still exist. So I'm going to just pop up and show and rear my ugly head in other aspects of either during the pregnancy and creating complications, or after the pregnancy and creating complications as well too. So it's not that we can just like, oh, poof, disappear. We have to at some point in time answer to why the body doesn't feel safe or doesn't feel like it's a great environment in which to reproduce or be pregnant, right? So let's really start from a high level. How does conventional care look at infertility, first and foremost? So usually, if you're struggling to conceive, you'll usually go to your primary care provider. They might turn you away and ask if you've been trying to conceive for more than a year, first and foremost. And if you haven't been trying to conceive for more than a year unsuccessfully, they'll probably tell you to keep trying and come back when it has been a year of unsuccessful pregnancies, or 6 months if you're over the age of 35, right? Because now we're considering you a high risk pregnancy or considering you more of a geriatric pregnancy. So if it's been a year and you've struggled to conceive, you're having now what we call unexplained infertility. Let's start to dig into some of the reasons why. You'll probably get a basic lab panel. Maybe you'll get like an FSH, an LH, maybe an AMH panel. You might get like a basic a basic semen analysis for your partner. So if you're heterosexual couple, the male will get their testing, female will get their testing, just to look at sperm morphology, sperm count, overall sperm number. Maybe the female will also get a thyroid check, but really then it's only going to be like a TSH panel, and it just barely scratches the surface, right? If everything looks normal in those panels, you'll be called and labeled, oh, an unexplained infertility, okay? And in those situations from there, now instead of asking about things like menstrual cycles, instead of asking about things like stress, instead of asking about things like gut health, microbiome imbalances, all sorts of things, you're immediately shuttled into more of your assisted reproductive technologies. Thank bless that we have them. We have them for a reason, but these are going to be more aggressive interventions. Things like Clomid to force ovulation, IUI procedures, which stands for intrauterine insemination, to place the sperm closer to the egg, because maybe there's a catch in the system between the sperm and the egg getting delivered to one another properly, or IVF, which stands for in vitro fertilization, which is more, we're going to go in and actually like collect the egg, collect the sperm outside the body and implant it into that female. So lots of different options, right? None of these normally covered under basic insurance. So people are normally paying out of pocket for these, and they are very spendy procedures with zero guarantee that they're actually going to work. Okay. So I've known couples that have gone through multiple rounds of IVF, multiple rounds of these things, and it fails time and time and time again. And then at that point in time, conventional medicine's answer is just try again. Try again. Oh, if it failed, we'll try again. It's like, well, at what point in time do we look deeper? At what point in time do we think differently? Either if we don't want some of these fertility assisted technologies at all, because from a budgetary perspective, or we just want to try to uncover all of those rocks to be able to conceive naturally first? Or what if we have repeated failed attempts and we're just chalking it up as like, my body can't get pregnant? Normally it's that's the problem in conventional medicine, is this approach assumes that pregnancy is just about getting the sperm to meet the egg. That's where conventional medicine thinks like, we're just not getting those two to meet, when it completely ignores then the deeper hormonal, metabolic, or even immune system factors that go into making or breaking someone's fertility. So the system here, from a conventional medicine standpoint, it doesn't ask why a female may not be ovulating in the first place. It doesn't ask why a man's sperm count is so low. It doesn't ask why implantation, maybe the sperm is meeting the egg, but it's not successfully getting implanted. Maybe there's not enough of a robust progesterone to actually even grow the overall implantation inside the uterine wall. And we're just overriding all of these questions of why, and we're kind of forcing the body to conceive, whether it's ready for it or not. Here we come, right? And so again, not knocking on any of these fertility assistive technologies at all. This is just having a very open and candid conversations about like, okay, there's that aspect where we can come in and kind of try to force feed and override some of these situations, or for certain couples where they've either tried that and broken the bank and it still hasn't worked, or for individuals that want to try to unearth like some of those questions of like, why is our connection failing at this point in time, and they're actually wanting to ask those deeper questions than just accept the label of unexplained infertility. Okay. And that's then where, from my standpoint, more of the lowdown methods come into play, because from more of a root cause approach, I'm looking at things very differently than conventional medicine. It doesn't mean conventional medicine is wrong, right? It's just like, they're just two completely separate mindsets. And I tell people this even outside of the topic of infertility. It's like, some people have the mindset of conventional medicine, and that is fine, right? They're wanting to like force the issue, fix the issue. And then more of like a functional or a lowdown methods mindset is like, they're asking the question, they're more curious. They tend to be the people that have the mindset of like, well, why? Why is IVF my only option? Is IVF my only option? They're the people that are not just like blanket accepting that is their diagnosis, that is their overall end result, and they are more curious, they're more questioning, and they're also, like I said, a little bit more intuitive to thinking that there may be something deeper here, okay? So instead of conventional medicine that really just asks like, how can I make pregnancy happen? I'm thinking about like, what are the barriers preventing pregnancy from happening naturally in the first place? Because let's look back at our lineage as human beings. We've done this a time or two, right? We've been doing this for thousands of years, generations upon generations of successful pregnancies. Why are we seeing such a massive rise and a massive uptick in couples struggling with infertility? I don't think it's some like all of a sudden we just lost that ability as human beings. So here's the truth. Your body is not designed to be infertile. Okay, that's what we talked about. Fertility is a sign of health. It is one of our vital signs, especially as females. It's like our monthly menstrual cycle, that is one of our vital signs. And so if our body is struggling to conceive, that should be a red flag to us that something deeper is off, right? So we see this all the time in women's menstrual cycles. What do? We shut them off. We ignore it. We're like, that's an inconvenience. Here's some birth control, right? When in reality, that should be our first red flag that like, ooh, hormones aren't happy, fertility isn't happy, overall health isn't super happy. But let's just shut it off. Let's quiet it and we'll just kick the can down the road and we'll deal with that later. And then we're surprised when we can't get pregnant later. It's like, yeah, remember all of those hormonal issues that you had when you were 15 and you started the pill anyways, and now you're 25, 26, 35, 36 wanting to get pregnant. It's like you think all of those hormonal issues just magically disappeared in the last 10 to 12 years that you were on the birth control. It's like, no, you just kicked the can down the road. It's like, and now we're going to deal with those hormonal issues, right? Or even a male, right? We think about this all the time too. If a male has, say, erectile dysfunction or issues with overall erections, we know there's a deeper cardiovascular blood flow issue. This isn't just like, oh yeah, I just have some really annoying ED issues. It's like, no, get this guy like a workup because there is a bigger overall vasodilation and cardiovascular issue, blood flow issue happening here, okay? Or we can just force the issue and give you some Viagra to make sure that that's not a problem, right? So we're doing this all the time in conventional medicine, is just like not asking why, but we're just, like I said, just fix it. Just fix it so I can move on. And really moving on is really just kicking the can down the road because eventually your body is going to make you answer to it. It just may be in different forms or different fashions or different symptoms, okay? So instead of overriding the body, I always ask, like, what are some of those things that are potentially getting in the way? Because again, our body wasn't designed to be infertile. A healthy human body is actually very fertile. And I honestly can't even tell you how many times throughout my time working in this field, how many times I've either had couples successfully become pregnant who were trying to. I've also had some couples that got pregnant accidentally because they're like, oh, we're way more fertile now that we're healthy. It's like, yep, sorry, that is also a consequence of that, right? Not, like I said, always very happy, but they're like, oh, that was a surprise. We didn't expect to either get pregnant that fast, or we weren't really thinking about that, or weren't really trying. It's like a healthy body is also a very fertile body, okay? So when I think about from a more like root cause standpoint, if someone is also curious like myself and is more minded into what are those barriers that are potentially in the way, because maybe they too don't buy this idea of just like unexplained infertility. They're like, no, there's an explanation. I'm just going to go find someone to help me figure out what that is. Even if this provider in front of me can't provide that explanation, it doesn't mean that explanation doesn't exist. So number one, if an individual comes to me and has some of these general questions and concerns, the first thing I always think about is let's get some data behind this, right? Let's test and let's see what's going on. So at the most basic level, you should be getting a full thyroid panel, right? Not a TSH, not just a TSH, a free T3, a free T4, a reverse T3, a thyroid antibodies. Like you should be getting at least 5, if not 6 thyroid markers. Like let's look at what the heck is going on from a thyroid standpoint, because that is the body's safety. The thyroid is always telling us how safe does the body feel. And if the body doesn't feel safe, especially from a female aspect, we're going to have impaired ovulation, we're going to have impaired implantation, we're going to have low progesterone. So the thyroid and fertility really do go hand in hand. And a lot of times I see that missed with just a basic TSH panel. Second, we're going to definitely look at blood sugar markers too. We have to rule in or rule out, like I said, is there some PCOS issues? Is there some insulin resistance issues? Those can be very detrimental to overall pregnancy. Looking at overall cortisol, right? Stress is going to be a big one. And we'll talk about this a little bit when it comes to nervous system function too. But looking at overall cortisol levels and cortisol patterns throughout the day. Gut health is a huge one, especially if there is some diagnoses around, like I said, a PCOS and endometriosis, unexplained infertility. There could be some toxicity issues, some dysbiosis issues. There could be some autoimmune issues going on. Even, like I said, specific nutrient status markers as well too. So when I say test, I'm not thinking like, oh, let's just grab a TSH and let's see what your progesterone looks like. It's like, no, let's get some comprehensive analysis here to really figure out where your parking brakes are. I don't order all of those tests that I just mentioned for everybody, but after an initial consultation, consultation and some like foundational labs, we'll know if there's any further digging and where we need to dig if we need to, because everybody's a little different. Once we identify, like do a little bit of some tests, don't guess, now we can actually identify what are those basic, or not basic, what are those barriers to infertility for that individual. Instead of just forcing pregnancy on the body, why don't we restore the body's natural ability to conceive by removing some of those parking brakes or removing some of those barriers? So it could be hormonal roadblocks like low progesterone, estrogen dominance, irregular ovulation. Again, the question is why? Why do I have that? Let's support why the body has low progesterone, why we have estrogen dominance, why we have irregular ovulation, which is probably because of some underlying inflammation going on, some underlying gut issues going on. There might even be, like I said, some environmental toxicity issues. That's where you'll really start to unearth, like, okay, what are those barriers in the way, and how do I remove those barriers and restore my body's natural fertility again too? This is a more comprehensive, holistic approach to infertility. It treats the whole system, not just the reproductive system. I'm not going to just pull the reproductive system out of the body, tinker with it, and put it right back into the same system that was dysfunctional to begin with, right? Because that's what I mean is like, by removing those parking brakes and restoring natural fertility, that individual is either A, going to be able to conceive naturally. B, if they do pursue IVF or IUI, the treatment will actually take, right? Versus them having to do repeated failed rounds and money after money after money out the bank. So that's always something that I consider too, is like, even if you decide or pursue more of those fertility assistive technologies, it's like, let's get your body in a place where something like that is going to work the first time, and the chances of you having a comfortable, happy, healthy pregnancy and postpartum experience skyrocket through the roof, versus like forcing the issue into a system that wasn't feeling safe to be pregnant in the first place. And now we're going to have all these downstream issues as well too. So that all being said, we also, at the lowdown, this is not something you're going to hear about from a conventional medicine standpoint, but at the lowdown, I also absolutely am talking about the nervous system aspect to this journey too, because that's a very overlooked piece of the puzzle. And it's like, if the body is perceiving all of these threats, either internal or external threats, chronic stress, blood sugar crashes, inflammation, even some unresolved trauma, mental emotional stress, it will absolutely shut down reproductive function. So know that the body is, like I said, it's just one. All of these systems are going to communicate together. So if your body is living in survival mode every day, it's going to prioritize keeping you alive over helping you get pregnant, right? And maybe that's things like over-exercising, under-eating, chronic stress, a dysregulated nervous system. It's like all of the supplements in the world will not fix your fertility struggles if you have nervous system dysfunction issues, right? So that is absolutely something that is part of the treatment plan. It's not something separate. It's like, no, mind, body, mind, both of those go together. So when I put together things like treatment programs for people, like, we're definitely talking about those types of things, not just the physical body that we unearth as well too. So just as a giant reframe around this unexplained infertility, know that your body, to me, your body is very wise. It's not broken, okay? The body is really seeing a system that maybe isn't feeling safe from a reproductive standpoint and feels more in survival mode. And so, of course, that whole process doesn't deem like a really great environment to bring a child into the mix, right? So instead of asking what's wrong with me as a female, or really internalizing a lot of that shame or guilt around infertility, really try to ask more curiously, what is my body trying to tell me? That is the question right there. And then listen. What is your body trying to tell you? Your body isn't failing you. It's trying to protect you. It's trying to protect you from something. So it's saying something isn't right. I'm feeling really stressed. I'm not feeling safe to conceive. And then when we listen to those, we actually listen and remove the barriers that it's asking us to remove. that now supports a more natural process where fertility can flow. Okay, so creating lasting and sustainable fertility, that's my MO. That's what I like to really promote and create, versus like just thinking about this short term, like we're going to get you pregnant and that's a success. It's like, well, I don't know if that's a success if like the entire pregnancy is miserable for her, as well as a postpartum experience, because you didn't care for her body first and then allow the pregnancy to be something that was a very welcomed addition to a well-resourced body already. That's just another piece of women's healthcare that to me just grinds my gears, because it's like ignoring the woman just for the sake of like the baby, right? Or the future baby in this situation. So key takeaways is just know that unexplained fertility to me does not exist. It just means that the person standing in front of you probably doesn't have the explanation for it, but it doesn't mean that the explanation isn't out there. And overall, fertility is a sign of health, and it's a sign of a robust metabolism. If there is issues with that, we don't have to just have the options. We do have them. We have the options to force a pregnancy through more conventional means, but you have the option to get curious, and you also have the full permission to question that there might be alternative paths out there as well too. That's really what this conversation is about, is just so that everybody out there knows and feels full freedom and autonomy to decide what path feels best for them. At that point in time. So just to kind of set the scene for some of the hormonal conversations and some of the fertility conversations that I want to have, is just, like I said, really like busting the box open and providing a safe platform for people to feel like there's options out there, and there's also more explanation than maybe you've been given. So hopefully you enjoyed that. Come back in actually a couple weeks for the next episode of Learn with Lo, and we'll keep dropping in on this infertility topic.